This is Indraprastha channel of Akashvani, Delhi. Biotechnology is a frontline area of science with immense potential for the benefit of the humankind. To achieve excellence in the promotion of biotechnology in the country, Government of India has been doing a lot. Listen to an interview with Dr. Rajesh S. Gokhale, Secretary, Department of Biotechnology, Government of India. Interviewer is Kaushik Roy.
We are privileged to have with us today Dr. Rajesh Sudhir Gokhale, the Secretary, Department of Biotechnology. So thank you very much for sparing your valuable time and speaking to Akashvani. Sir, can you tell us about the achievements of the Department of Biotechnology since 2014?
First of all, thank you very much for having me on this show. Actually, it's my pleasure to be part of this show on the radio. I think Department of Biotechnology, first of all, maybe let me give you a background. It's a rather unique department in Government of India actually. It started in 1987 and not very many countries have this unique department as part of governmental endeavors. In fact, in India was one of the few countries that had it. Since 2014, it's been a transformative time for our department's time. This government has played colossal amount of role in trying to enhance the many facets of Department of Biotechnology actually. Primarily, we are in the business of promoting excellence and innovation-driven discovery research and entrepreneurship in biotechnology and modern biology. And this has been our major thematic areas. And what we really try to do is one of the key aspects is to boost biotech research in the country, to create world-class research labs, facilities such that they help scientists make breakthroughs in areas like healthcare, agriculture, and environment. And that's been our major achievement actually. Our labs are state-of-the-art labs, laboratories in the country, and there are 15 of them spread all across the major metros in the country, and they're really top-notch in technological perspective. So we are very competitive internationally in terms of doing these kind of activities, and much of the credit goes to this government for facilitating, providing funding, providing good support and environment around this. Also, what was incredible actually, what happened was the COVID times, and it's been an eye-opener for several of us who work in healthcare related sectors actually. And what Department of Biotechnology was given an opportunity was to lead a program called Mission COVID Suraksha.
Yes, I'd just like to mention that under the leadership of the Honorable Prime Minister, especially the Department of Biotechnology turned that very difficult COVID-19 time, the pandemic times, into a time of an opportunity. When opportunity comes calling, you got to have grabbed it, and that is, I think, where what you actually mentioned is that you seized that moment.
You're absolutely right on that actually. I mean, I think it was really departments, credit to departments in the department and scientific community all together,
right,
which came together to really put together their all the energies, knowledge and all the competence together to make sure that this is actually we come out winner. Today the country can be proud to say that everybody used to worry what will happen to the country with 1.4 billion population. How would you vaccinate people? How do you test people?
And we achieved that in record time.
Absolutely.
With
stunning.
All the stakeholders doing a commendable job.
It's a very stunning piece of thing what we managed to do. And not only that, we actually took this opportunity to develop every single vaccine platform that is now internationally available, whether it's a subunit vaccine, DNA vaccine, RNA vaccine, or nasal vaccine, or complete viral particle vaccine. Now, these are all the platforms that are available internationally. Now, Indian companies are on the top of the technological prowess. And this is not just discovery phase, but even the manufacturing component of it is also very good. So I think this has somehow enhanced India's image, and now you can say we are the world leaders in vaccinology actually. And obviously much of the credit goes to the vaccine development is one aspect, but you require animal models, immunogenicity assays, testing facilities, various bioassays needs to be done. Now all of these done in various institutions that are coordinated in the Government of India. So it was a rather unique case of how people came together to build and come out as a very successful out of this entire ecosystem. And I think this is something that India is very proud of actually. And I think all the energy that has been spent in setting up these things have really given value to the country actually. And I think that's where department feels proud about. I mean, of course, we don't want such events to happen very often.
True.
Because that's not what we are looking forward to. But it's the kind of, as you said, you seize the opportunity and then you make it count.
Yes.
And I think that's, I would completely
So, can you just throw a little light on the Genome India project and India's first indigenously developed quadrivalent human papilloma QHPV vaccine and other things, and also later on we'll come to the most important, that is the BioE3.
Sure. I think the Genome India has been a rather spectacular project in terms of how to put together whole genomes of 10,000 individual humans of our country and a comprehensive catalog of unique diversity of what exists in our country have been put together. So as you know, from a point of view of anthropological point of view, there are all sorts of different people are there in our country, different parts of our country have different kind of races, different ethnicities.
Yes.
Now, many of us have variety of, marriages and other kind of conjugal aspect of has happened. So this has resulted in a gene pool that is very unique and very, very diverse of our countries actually. It represents Caucasians, it represents Mongoloids, it represents Dravidians, it represents Aryans, mixed communities actually. So our country has this unique character and cultures, and this has been put together in a genome. 10,000 genomes of these people have been collected over the places and sampled around and have been sequenced and put together as a comprehensive database that is now available for researchers to use. This database consists of people who are healthy population. So therefore this gives a what you would call a baseline population of a country of what is an healthy individual is actually.
Right.
Because as you would know that each genome consists of 3 in 10 power 8 bases. So it's a rather very, very large repository actually. And I would correct 3 billion bases actually. Each human genome has 3 billion bases actually. And so 3 billion bases for 10,000 people is now deposited in what we call Indian Biological Data Center, that is set up as a primary raw data center present over here in India, which is in Faridabad in one of the DBT institutions actually. And people can now access this data, analyze, understand what are the rare variants in the country, what are the unique variants to each populations are. And on the top of this now, what we will do is we will try to do genomics that is related to disease biases. So for example, now you look at people who are having cancers, people who are having diabetes, people who are having rare diseases, cohort populations. So you can identify these mutations that are then prevailing in the population and then correlate it to it actually. And then there are technologies that are emerging, like one of the technologies that what we call CRISPR-Cas technologies actually, which are genome editing technologies, where you can go back and modify the genomes of the individuals with precision. And these are going to be transformative medicine practices that will completely change the paradigm. And I think what India is willing to do is ready now, and with this government's very forward-looking approach, that we are now ready to take plunge into these larger areas of success stories actually. And this is one of the key success stories of it.
And so about the QHPV vaccine and BIRAC that received market authorization 2022.
Yeah, so this is a quadrivalent human papilloma virus vaccine actually, and this vaccine provides protections against cervical cancers.
That's very important.
Now, what happens is that there are 4 virus variants that are prevailing in our country. 85% of that which causes cervical cancers, viral mediated. There are other reasons that as well happen, but these papilloma viruses actually causes cervical cancers in future, and their infections happen typically in an early part of human life, but you develop cancers in future. So what we have done is we have developed this quadrivalent vaccine in collaboration with Serum India, and Serum is going to have got a market authorization to now actually develop and implement it in the country, is to be able to start vaccinating young girls first, because they are the most susceptible one, because obviously you have to deploy it, you go in the stages, and then maybe boys as well, because papilloma virus does cause male infections as well actually. And I think this has been an indigenously developed vaccine, quadrivalent vaccine actually. So all the research was done here, all the innovations were done here, the trials were done in the country actually. And
timeline, you see that this vaccine will be available for immunization, if I may use the word, for young girls, as you said.
So I would think in next 6 months it should be rolled
That's
out actually.
wonderful.
I would be very surprised if that doesn't happen so. But clearly this now part has to be done by the Health and Family Welfare actually, ministries actually, because the deployment is not our job of the work actually. So Health Ministry will devise guidelines and how to be able to do it. Of course, it requires tremendous amount of networking, because do you start from the schools? How do you go to the schools? How do you educate them?
Yes.
So I think government has already started various programs to educate these activities, and I think that's what is likely to be.
The government has also introduced the Bio E3 policy, which is a very important policy. Can you throw some light on this, sir, and how do you think it is going to change the biotechnology field?
I think Bio E3 is a game changer for our country actually. It's basically a biotechnology for economy, environment and employment actually. And talks about that how biotech ecosystem will provide opportunities in each one of these paradigms to be able to make our future more secure and more sustainable actually. And there are enormous global challenges that we have to face actually, which requires really sustainable interventions, which are, for example, climate change, unsustainable material consumption, waste generation. All of these are related to the activities of physical world. Materialistic and physical world, and we have to live with it actually. But finally there is only a limitless stuff that is available for all of us. Biological interventions can really work around this to be able to make sure that we have a much more sustainable methods and ways of happening it. This Bio E3 policy lays down a framework and give directions for future scientific, industrial and societal achievements. It's one of the commitments to future which is more secure, innovative and responsive, and we also would like our country to be part of next industrial revolution, which is going to be industrialization of what I call biology products. Many of these manufacturing will in fact become a completely change its paradigm and will become more sustainable actually. And I think this is what the whole policy is about actually, and it's got 6 sectors that are strategically positioned for it actually. So one of them is bio-based chemicals and enzymes, functional foods and smart proteins, precision biotherapeutics, climate resilient agriculture, carbon capture and utilization, and the marine and space research. So these are 6 sectorial parts in which we will carry out very focused activities. And much of the role of this is to set up what we could like to call biomanufacturing and biofoundry hubs. Now, the startup that has provided a momentum in the country requires a mechanism to scale up their technologies.
True.
Because startups are small companies and they always look for infrastructure, and also this biomanufacturing and biofoundry paradigms through Bio E3 policy will provide them an opportunity to scale up such that they are start to become more commercially relevant and important activity, and that's the part of this Bio E3 policy is actually.
And it is in complete alignment with what we say, this lifestyle for environment, which the Honorable Prime Minister has also on various platforms has called for this.
Yeah, you're absolutely right. I mean, I think that's the complete 1:1 alignment with what that is. That is about our lifestyle, of how our lifestyle can in fact should change such that we are in sync with nature. This is scientific and technological prowess that allows us to grow further.
True.
And I think that the two hand in hand together, therefore I think our Union Cabinet approved this, chaired by Honorable Prime Minister actually on 24th of August. And Honorable Minister released this policy document on 31st of August actually on this. So I think it's a great futuristic roadmap for our country and provides how we would like to progress in all the 3 fronts: scientific front, industrial front and societal front, to make sure our country is really secured for future generations.
Dr. Rajesh Gokhale, Secretary Department of Biotechnology, we thank you once again, sir, for joining us and talking to us at length about the important events that will take India to becoming Viksit Bharat by 2047. Thank you indeed, sir. Thank you for talking to Akashvani.
Thank you. It's my pleasure.
You were listening to an interview with Dr. Rajesh S. Gokhale, Secretary, Department of Biotechnology, Government of India. Interviewer was Kaushik Roy. Narrated by Nisha Bharadwaj and presented by Dilip Jha. This broadcast came to you from the Indraprasth channel of Akashvani, Delhi.